How do I know if I have a headache, whether it's just a headache or a brain tumour?
I must, from the beginning, be very clear that most headaches are not brain tumours. That migraine, stress, just a bad day at work, we all know a headache. Having said that, it's quite interesting because I don't know whether you've ever had a cold, and you must have done, or an influenzaal illness. The first place viruses go is in the brain. So patients will say, people will say, oh, I had a headache, and that's a prelude to influenza or a cold. So the headaches are so common that one would say a minute percentage of people having headaches, which is probably everybody at some time, some place, and poor people with migraines suffering all the time and having to go into dark rooms. But this is very rarely a brain tumor. Having said that, you are absolutely right that headache can be a brain symptom of a brain tumor, particularly if it's associated with vomiting in the morning usually. That can be indicative of a brain tumor. Now, severe and persistent headaches need to be reported, and I really mean severe and persistent. Weeks, perhaps even a month or two, they need to be reported. One of the problem with brain tumors, and it's a real problem, is that it's very difficult for a patient to know what they've got because the symptoms can be so diverse, headache being one of them, that it flows and it spreads into so many symptoms that and behavioral issues that the poor patient just doesn't know. But I must emphasize that the headache is usually not a brain tumor, but is a symptom of brain tumors in many cases. Now, I would advise persistent, severe brain headaches in people who never get headaches. This does have to be looked at, and hopefully it will be eyesight problem, something quite benign. But you are quite right that headaches may be a symptom and the first symptom of patients with brain tumors.
And why would there be vomiting?
The vomiting is related to this raised pressure, which I've explained. You've got this brain surrounded by this bony skull, and it causes raised pressure and swelling, and this will affect the centers governing nausea and vomiting. So, but that usually means the pressure has risen in this box, in this cranium, in this skull. The pressure's risen, therefore it then causes the vomiting.
And what other symptoms might there be apart from headache and vomiting?
For brain tumors,
Yeah.
brain tumors are extremely intriguing in that a patient may have a brain tumor for, I believe, up to 20 years, and they will have behavioral problems. They don't realize they're behaving differently, but often in retrospect, the wife of a patient or the son of a patient or whatever will say, yes, my husband was different for the last 2, 3, 4, 5 years. And up to 10 years is quite possible. I believe even up to 20 years, depending on the malignancy. The more malignant tumours will grow more quickly, therefore probably they're starting 2 to 3 years before diagnosis. The more benign tumours, the less aggressive tumours, maybe 10 years before diagnosis. So it could be changes in personality, which can be very subtle. It can be a person becoming more angry, more anxious, some different attitude in their marital relations or in their relationships at work, maybe lack of concentration. So it can be any part of our human behavior could indicate a brain tumor. Now, the other not an uncommon, particularly in benign tumors of the brain, is visual problems, and often the population will go to their optician, and the optician will find that they have abnormalities. When you go to have your eyes tested, you look into some apparatus or other. It used to be an ophthalmoscope where the optician came to you, but now you look through sort of lens equipment. And very often, brain tumors are diagnosed by opticians. So there's behavioral changes, there is defects of vision, there's the headaches, which we've mentioned before. There may be fits. Now, fits are particularly tumors in certain parts of the brain. A patient will get a fit. The fits vary too. It can be that just their arm shakes for 2 or 3 minutes and they think nothing of it, but then realize it's abnormal. We call it Jacksonian epilepsy. That can be a symptom. Or they can have a fit, as we think of a fit, actually fall and foaming at the mouth. That's another way it can present. It can present with a general feeling of disability. But I think, and it will also depend, and this too will need another discussion, whether the tumors are in fact malignant, benign, primary or secondary. I just want to give this add that not all tumors in the brain start in the brain. Very often, 20 to 40% of some cancers spread to the brain. And that will have another symptomatology, because in those cases, the tumors are not usually one, but several small tumors. So we really are dealing with such different and diverse symptoms, which makes brain tumors so difficult to understand and to know and to feel. For instance, we're told a lady with breast cancer usually presents on screening or with a lump in the breast. With esophageal cancer, some difficulty in swallowing. In brain tumors, it's much more complicated. Headache and vomiting may be the commonest symptom, but not usually. Fitting is quite common in the more malignant tumors. There may be sort of odd neurological symptoms. What I mean by this, something like a Bell's palsy may occur. Difficulty in walking, dragging a limb. And then we've got this whole new problem. Is this a brain tumor or is it a stroke? It can present exactly like a stroke with somebody not speaking at all, and dribbling at the mouth. Or it could just present with difficulty in speech, or even more complex, the patient may not be able to express themselves, or they may not be able to understand what others are saying to them. So we really are in a minefield of diverse symptoms, signs, and it turns out for those poor patients who do have some of these symptoms, that it is an intracranial, and I use that again, in the skull, tumor of some sort. Thank you for listening. I hope you found this interesting, and if you did, please subscribe.